You're fired. Tough words. Those are real tough words, ones we don't ever want to hear or use ourselves. But you know what? Sometimes in your career as a therapist, the day will come about when firing your client will almost be a must and possibly even a necessity. Why do I say this? What rationale can I have to support the idea of firing our clients and then to refer to it as a necessity? After all, did we not enter this profession with a sacred oath, albeit nonverbal, to care for and heal all who come to our treatment area? This kind of thought is almost heresy. We're healers, and this should never even cross my mind, right? Besides, what about paying my bills and supporting my lifestyle? At least for this reason, shouldn't I keep them coming in no matter what? Well, here's my rationale. This event occurred just recently in my practice and it sparked me to journal this thought, so I want to share this with you. How many times have you gotten so comfortable, like the proverbial old shoe, and complacent with your relationship with a particular client that you actually have slowly become ineffective? But because of the long-term relationship you have now become emotionally attached and now cannot be objective enough to be on your game. You remember, like the first time they were your patient and your brain went into high gear trying to solve their problem? You could see and envision all the solutions. You were unstoppable. But now, like the saying goes, familiarity breeds contempt, and you have become blind to the solution that will help them achieve optimal health and wellness. What ends up happening in most situations is that both you and your client becomes frustrated when a chronic problem continues to persist and both you and them can't overcome the close relationship to see that the treatment relationship has become ineffective. Sometimes the only clue that sparks you into waking up to the reality that the chronic issue is still chronic is when they mention seeking the advice of someone else to remedy the problem. This is when you realize that you have become too familiar to be sensitive to the lack of changes in the condition. So, why does firing them make sense? Well, this can often be done to serve two purposes. First, to facilitate your client's ability to seek the appropriate help for his or her condition, which may be beyond your scope of practice and level of education or experience. Second, continue to treat your client with the awareness that their problem still lingers on can often be completely demotivating to you, which can eventually lead to frustration and a loss of confidence in your overall ability to provide adequate treatment in your practice. So in closing, I say sometimes it's actually beneficial and a professional courtesy to just fire your client. On some levels, this kind of action could actually deepen your relationship with your client. They'll respect you more. Well, that's it. Until later, give it some thought. Hey, it's your coach, Alvin. Let me know how I can help. Talk soon.